My name is Kathleen Morgan. I'm a licensed marriage and family therapist, and I just moved to Colorado about 5 months ago, just in time for the COVID stay-at-home order. So I am also studying towards my LAC. We didn't need that in California, but I've been working in the field of addiction and mental health for 10 years. My original master's degree was in holistic wellness, and I did an emphasis in treating addiction holistically. I was a yoga teacher full-time then, and a lot of students I started noticing were using yoga as an alternative approach to a recovery support group. Back then it was mostly 12-step. And as I worked with these students and started noticing the brain-body disconnection, I thought there's so much more going on here. I should probably go back to school. So I got my master's degree in clinical psychology with an emphasis in marriage and family therapy, and from Pepperdine in California. So like I said, I've been working in the co-occurring disorder field for 10 years now. I'm certified in EMDR. I'm a certified anxiety treatment professional. And like I already said, I am studying towards my LAC. And next weekend, or this upcoming weekend, I start my first training series in brain spotting. So I'm very, very interested in trauma. I'm also a registered trauma certified registered yoga teacher. So I do a lot of brain-body stuff in my work. But today what I want to share with you is the work that I did for the certification program as an anxiety treatment professional. So what I'm going to give you today is just a glimpse of a 19-hour certification course. But what I am going to give you today, you can absolutely start working with your clients right away. So the objectives of today is being able to explain the neurological process underlying anxiety in a clearly understandable manner to your clients. Be able to recognize the difference between the cortex-based and the amygdala-based anxiety symptoms. Use proven strategies for calming and training the amygdala, and all this you're going to get today. Be able to employ proven methods for retraining the cortex to resist anxiety rather than ignite it. And then finally, and I hope we get to this piece, just describe how medication can promote or impede neuroplasticity. So as treatment providers, we don't stop doing everything we already do. Building rapport, demonstrating empathy, setting goals, and especially with this particular technique, you want that bond to be really strong. They really need to trust you and feel like you're in their corner with support. You need to be able to expect and promote change. Research has proven that there is no proof of a chemical imbalance causing disorders. And I know, and I'm sure you've heard clients say, well, I have a chemical imbalance. Well, science doesn't prove that. Research hasn't proven that. So we're going to be working with the mind. So the mind is what can change the brain. And when I say the mind, this is just your mental processes that are created in the brain, like the sensations, the thoughts, the emotions. And obviously the brain is just that physical, visible, biological basis for the mind. Parts of the brain only learn with experience. So for the brain to learn, homework is going to need to be given and reviewed. Language is really important, our language and theirs. And we're pretty used to this as clinicians anyway. Listen to how the participant is explaining their symptoms, because that's the language we're going to use when we're working with them. And obviously don't jump in too early with how to fix it. And we all know that. But in this particular instance, we really want to gain as much information about all the areas that the anxiety is affecting their lives before we start working on cortex-based or amygdala-based interventions. We want to help them change their brain, not change their anxiety. Obviously, ridding oneself of anxiety is not possible, and it's not necessary. So once the brain is healthy again, the anxiety will actually be at a healthy level. So change isn't about reacting differently one time or trying to experience an anxiety-provoking event differently. This is really about changing the brain. So the goal is to change the way the brain responds. Like I mentioned earlier, we have to be a partner in their distress. Many strategies for promoting changes in the brain are effortful and require repetition. They produce anxiety that must be tolerated, and we have to be there with them. Participant needs you to provide rationale for tolerating distress in hopes of changing the brain. And that's what you're going to be able to do. Participant is more willing to undergo this distress with your support. So Dr. Catherine Pittman has coined this phrase, neurologically informed CBT. So NICBT for short. Many CBT strategies can be used effectively to rewire the brain. So don't stop doing your, challenging the cognitive distortions, the cognitive restructuring, the psychoeducation, the homework. Don't stop doing any of that. That's going to be needed. However, the assumption that all emotional reactions are mediated by cognitive processes is inconsistent with our knowledge now of the amygdala's functioning. CBT was not based on neurological knowledge, but it sure has really worked well for all of us. In addition to the CBT strategies, we will also have to address exercise, sleep, relaxation, and exposure techniques in order to address the amygdala's role in producing the anxiety. And for those of you who practice EMDR, remember EMDR is a form of exposure therapy. So the amygdala can trigger emotions, and there doesn't even have to be a cognition linked to it. So sometimes we're just going to be triggering the amygdala. So Karen, please stop me if you see any questions in the chat box, since it's not showing on my screen.
I will. I'll keep you updated.
Okay. So NICBT, the strong focus is on the present. Focusing on the past actually strengthens the unwanted circuitry. And for any of those of you who work with patients with generalized anxiety, it's very hard to get them to stop talking about what's making them anxious. And they just think if they can just get it out, that it can all come out. But let them know that this is actually strengthening that circuitry that we don't want anymore. Psychoeducation on your part is essential to this therapy. So knowledge of the brain's role in creating the anxiety. We need to understand this knowledge, and we need to be able to impart this knowledge to the clients in a way that they're going to be able to understand it. The new understanding of anxiety is what promotes tolerance of it. Tolerating anxiety is actually what changes anxiety. And I know from years past that, and I work in treatment programs, if a client came to us with social anxiety, the first thing we would think of as a team was, okay, well, let's do less group work and let's do more individual work. And that's not helping the client at all. That sense of dread, Yeah, and a lot of clients will say that, yeah, but I wake up with anxiety. Well, that sense of dread may be there even before they're fully awake, but it doesn't predict the future. That's a little bit of CBT work we can do. But what's most important is to let them know it's a program response built into us. This is a survival technique. There's some new research out that dehydration, that there's a link between dehydration and anxiety. And that's also really useful information to pass on to the client. Sometimes just getting some water in the morning can relieve that anxiety. Neuroplasticity. So definition, the ability of the brain to change its structures and reorganize its patterns of responding. Now, this isn't what I would share with the client. What I would share with the client is what I have down below, more everyday language. Your brain doesn't have to react this way. You can make your brain more resistant to anxiety. We can work together to change the brain to stop doing this. Your brain is capable of changing your thoughts, your feelings, and your responses. So just the scientific language isn't necessary unless you have one of those clients that really likes that stuff, then absolutely give them that. All right, getting into the science, there's 2 pathways to anxiety. And if you'll notice, I went ahead and I put all my notes down here at the bottom. So any of you that are getting a copy of this presentation, you've got all the additional stuff that I'm saying for you at the bottom. So there's 2 pathways to anxiety. One, and all information comes in from the thalamus. So it comes into the thalamus through the detailed focus circuitry of the cortex, and eventually gets down to the amygdala, which produces the anxiety response. And this is called top-down emotions generation. The other pathway comes into the thalamus, but it hits the amygdala first, and then the amygdala up to the cortex. Obviously, this is your bottom-up triggering of emotion. But as you can see, this amygdala has a role in each. Now, what's interesting is that the cortex, that rational thinking part of our brain, actually has fewer connections to influence the amygdala than the amygdala has to influence the cortex. There's actually more connections that go from the amygdala up to the cortex than there is coming down. Anytime you hear, I can rationally tell myself that I shouldn't worry and everything's going to be okay, anytime you start to hear that phrase come out of their mouth, it's time to trigger, or it's time to target the amygdala. Some of the things like phobias and PTSD, we're definitely going to target the amygdala. If it's OCD or GAD, then we're going to target both. And the longer certification course really goes deeper into targeting more of the trouble areas like the phobias and the obsessive compulsive disorder. So the amygdala. So the role of the amygdala is to attach emotional significance to a situation or object and to form emotional memories. It has many different purposes: love, bonding, sexual behavior, anger, aggression, fear, and it has just so many more things that it does to influence the body and the brain. It controls many different reactions, both in brain and body. Remember that the cortex cannot affect the amygdala in the immediate response. There's at least a 2 to 3 second delay depending on how hyped up a person, how hyped up the body's response is. So the language of the amygdala is not logical. it turns certain situations and objects into triggers for anxiety. And I think you've probably recognized this, and even the client has recognized this, that pretty soon almost everything in their life becomes fearful. So scientists have not only located where the triggers are created in the amygdala, but also how to train the amygdala to stop responding to them. And that is really exciting in our field. What they found is the amygdala needs experience to learn. Talking does not heal it and may even create disordered behavior like compulsions, worrying, avoidance. But interventions that work. So to help reduce anxiety within minutes, the diaphragmatic breathing, I think we all use it now. Aerobic exercise and yoga. So a lot of times the client might discount interventions like diaphragmatic breathing, and we can just simply say to them, since it relaxes your amygdala, the amygdala is going to send a signal that you're safe. That's really all we need to remind them, that there's a signal being sent that tells them that they're safe. Once they're safe, they start to calm down. But as clinicians, the diaphragmatic breathing, so that belly breath, and I'm just going to go on the bottom now, stimulates that vagus nerve. And the vagus nerve is the largest nerve in our body. It actually runs all the way down the spine. And as we take that deep breathing, it starts massaging that nerve. And I mean, some of the things that it does is like lower blood pressure, reduces the respiration process, the heart rate. It actually removes lactate out of the blood, which can cause anxiety. It increases the alpha brain waves, which are associated with calm alertness. And it also causes serotonin to be released, all these really good feel-good things. It can activate the prefrontal cortex within 10 minutes. So that does depend on, if they're having a panic attack or just a full-on panic attack or a mild panic attack will depend on how long before the frontal cortex comes online. With the aerobic exercise, I love to take people for walks around the building. Once the anxiety starts, just getting them moving and taking them outside the office for the session is very helpful. Like I said, I am a registered yoga teacher, so at times I'll run them through a series of sun salutations. And you really don't have to be a registered yoga teacher. Obviously, you have to practice yoga to even know what a sun salutation is. But if your office is big enough, sun salutations work really well. To reduce activation of the amygdala over time, now they're going to need regular aerobic exercise. There's yoga again. And the reason yoga is there is because of that breathing that's so important during a yoga practice. So, and then adequate sleep. And I'm going to be talking about sleep a little bit later. But to rewire the circuitry of the amygdala and produce long-lasting change, there's going to have to be some exposure. So let's start with the amygdala-based interventions exercise. Just 20 minutes of exercise shows effective to reduce anxiety. So like I said, I'll take clients around the block, or just, when you're encouraging them to have their own exercise program, to say, start with 20 minutes a day, or 20 minutes a few times a week. Regular exercise reduces sympathetic nervous system activation, counteracting the amygdala activation, and that's what we're trying to do. Exercise is like this reset button. The exercise actually, as the body is warming up and everything, it starts training the amygdala that it does not need to go into that fight, flight, or freeze mode. It starts to calm down. It's actually a way of telling your amygdala to stand down. And then exercise makes a certain kind of serotonin receptor in the amygdala less active. So yes, I share all this stuff with my client. Basically everything except for maybe top down and bottom up, I share with my client.
We have a really good question actually from Melanie, Kathleen, and her question is, what would you recommend for clients who have severe physical limitations?
So Melanie, when I think of severe, it could go anywhere. So I would, that you're going to have to collaborate with their physician as far as what their limitations are and how to get aerobic. I would need a little bit more information, but I mean, I would probably collaborate with their physician. Hopefully that answers your question. All right, so I'm not going to cover amygdala-based interventions, the relaxation training. I think that we have all become very adept at doing that with our clients and teaching that to our clients, and there are a plethora of apps that they can also do. But one thing that we do want to let them know that by relaxing the muscles in the body, once again, it sends that signal to the amygdala that they're safe. And so relaxation training is very important. So let's go into sleep. It's the lack of REM sleep that makes the amygdala more active. And it takes at least an hour before we even enter REM sleep. So sometimes people might need to add more time to their alarm clock, just knowing that it's going to take them at least an hour to get into REM sleep. Napping does not help. Actually, it kind of hurts sleep patterns during the night. And you will probably hear clients say, oh, but I love to take naps. I dream so quickly, but dream state doesn't necessarily equate with REM. So let them know that. It's the uninterrupted sleep that is essential to get into REM sleep. So I'll go over some effective sleep strategies. Some of these you may already know. If you need more than these couple of slides, there are some on the internet too. So before they go to bed, have them practice the same relaxing rituals to train their brain to sleep. And honestly, this could be as simple as putting on your pajamas and brushing your teeth. Just having some ritual that signals, okay, we're getting ready to go to bed. And we all know this, eliminate the light stimulation for at least 1 hour before going to bed. That includes screens, cell phones, iPads. This is really shown to actually stimulate the brain long after we turn the lights off and try to get to sleep. But the darkness actually signals that it's time to go to sleep. Exercise during the day, this helps stimulate sleep. And we have some people who exercise at night. That's okay as long as it's not interfering. Once again, avoid napping. If they have trouble falling asleep, have them replace activating thoughts with relaxing thoughts. If they have a difficult time switching that off, I usually suggest like sleep stories. Music may or may not help with somebody who can't turn their thoughts off, because we can sit there and ruminate with music going on just as easy. But when I'm talking about sleep stories, I like to suggest children's stories because, the content is not as stimulating. So bedtime stories can be found on YouTube or on apps like Calm. But I suggest if they're getting stories off YouTube and they don't have a subscription, even if they do have a subscription, I suggest that they really try out different sleep stories, make sure they're long enough in time, make sure they like the narrator's voice. And if they don't have that subscription, make sure there's no commercial breaks, because that could be frustrating. If worries haunt them at bedtime, have them schedule a worry time during the day. And I actually like to use worry time as an assignment. I wouldn't let them go for more than 5 or 10 minutes. But whenever they start to worry, if it's not their worry time, they need to tell themselves, okay, I'll worry about that during my worry time. They can worry about everything they want for 5 to 10 minutes, and then they have to set a timer. Ensure that their sleeping environment is conducive to sleep. Maybe too many pillows on the bed, maybe too many blankets on the bed, maybe your pets are on the bed. Or some people still have those digital alarm clocks with those big red or green numbers. Have them face that away from them. Because if they're having problems sleeping, they usually start waking up and glancing at the clock for the time. And they can always use the breathing techniques to prepare for sleep. And avoid prescription sleep aids. Melatonin is okay. The ZzzQuil, now ZzzQuil has a product called ZzzQuil Natural. It's a blend of chamomile, lavender, and melatonin. It also has several chemicals in it. So for those of your clients that are more holistic, that may not be an approach. Maybe they want to go to Whole Foods and just start picking those own ingredients out for themselves. So amygdala-based interventions, exposure. We have to put the amygdala through some exercises because it needs experience to learn. They're going to have to push through that anxiety to be able to change the amygdala. So we can tell them we need to activate the amygdala to generate new connections. This is what I share with them. And I also share that activation is not going to be pleasant, or it may not be pleasant, but it will probably only last 6 minutes. Sometimes when they hear 6 minutes and you can set a timer or whatever, they can usually push through for 6 minutes. Share with them avoidance robs the amygdala of opportunities to learn new ways to react. So this is so important because this is what I see is the most, is the avoidance. And the avoidance also tends to strengthen that message to the amygdala that something really is wrong. And then there's one more thing that the amygdala has to remember. No amount of talking to the participant about the anxiety will heal the amygdala. It may likely increase the anxiety network. Now, I know that I've probably already said that 2 or 3 times, and we're only, 30, 35 minutes into this. You can't imagine how many times she said this over a 19-hour period. So this was very, very important. Did we have a chat come in, Karen? No? Okay.
No, it was just the last question about the physical limitations. So
Thanks, Laura.
Good. Okay. Yeah.
Well, I had planned this for some people to be asking questions. I'm going to be wrapping up in the next few minutes, so we can maybe chat at the end. So, medications. Some medications actually prevent the amygdala from learning, and they are addictive. And this, of course, is our benzodiazepine family. Benzodiazepines will actually make the amygdala more sensitive to anxiety. And sometimes, besides the withdrawal from benzos themselves, the anxiety is almost unbearable. if your client is already on benzodiazepines, educate them about how they're preventing the amygdala from healing and how the amygdala is actually going to have an increased anxiety response because of them. And if they're willing, refer them to their physician to start the taper, to start titrating off. Some medications actually prevent the brain from going into proper sleep cycles, even though they are prescribed for sleep. And these are sedatives. Once again, if you have a client on this medication, educate them that this medication is really only supposed to be prescribed for like a 2 to 3 week period of time to get somebody through, and maybe a death in the family, maybe an exam, whatever it is. It's really only supposed to be so short term. If they've been on it longer, once again, refer them back to their physician. Some actually help the cortex be more available to changing thought processes. Those are your SSRIs, and I've listed, a few of the common ones right now. The SNRIs, the tricyclic antidepressants, buspirone. And just know that the buspirone has not been found to be effective for more than about 3 or 4 weeks. So if you have someone on that and they're saying, I just don't find it effective anymore, they're right, and refer them back to their physician. I've also had many clients say, my SSRI isn't working anymore. I'm going to see my doctor to increase the dosage. And, I work in the addictions field, and many times, that feeling when somebody finally gets to the SSRI dosage that's optimal, their thought processes does clear up, and they're thinking more clearly, they're acting more focused. They haven't maybe been this focused in a very long time. Well, if this much made me this focused, then this much must make me more focused. And so that's not necessarily the case. Once they're to their optimal dosage, we need to educate them that we're actually getting the results we want. You're having clearer thought processes. You can do the work now. You're more focused. So educate, because, our clients usually aren't in with the psychiatrist more than 10 or 15 minutes. And the medical doctors really aren't as educated, and we need to be their partners. So in summary, it's the exercise, the sleep, the exposure. I forgot to add the relaxation techniques can actually heal the amygdala, which in turn is going to reduce the anxiety. That's what we're going for, healing the amygdala. Thought replacement and other CBT interventions will keep the cortex healthy. Cortex needs to stay healthy so it doesn't keep activating the amygdala. Our part as the provider is to offer support, educate, and assign homework. And if medication is indicated, and hopefully you'll be able to recognize when it is, those are going to be the ones that absolutely cannot stop ruminating. Those are going to be the ones that ruminate and go into panic attacks. Suggest the SSRI and the SNRI family. So on the resources page, the first one at the top, Dr. Pittman does have a book called Rewire Your Anxious Brain, How to Use Neuroscience of Fear to End Anxiety, Panic, and Worry. This is a great book. This is what her whole theory is based, or this is what the whole presentation and certification is based on. I've added a couple of my favorites onto this slide. So like I said, I like the Little Prince, or I like children's stories because they're not the content isn't too involved. I like The Little Prince. I like it when it's narrated by Humphrey Bauer. You can buy the audiobook and then you know it's narrated by Humphrey Bauer, or you can use this link because there's many to select from. I know this one doesn't have any commercial breaks. And I doubt they'll be, I'm sure they'll be sound asleep before they ever get to the end. I also like binaural beats puts out different, what do you call them? Solfeggio frequencies. So they have one that's called the delta brain waves, the deepest healing sleep. The delta brain waves are what we go into during deep sleep. So those who can tolerate their thoughts and be able to change their thoughts while they're going to sleep, this is a nice thing to listen to. This one also does not have any commercials. None of these do. I also like binaural beats, also has a serotonin release, and this is the alpha waves. And we can suggest this to clients, like if they know that a task might create some anxiety, they can listen to this in the background. And this is that calm alertness that comes. This is also very good for, alert meditations. And then obviously there's any number of apps now available. I just happen to list Calm. I know there's Insight, but there's just too many to list. One thing about Calm, though, that I have noticed, none of their bedtime stories are probably long enough for our clients. The longest one you might find is 45 minutes, and we're really looking for something that's more than an hour for them. And also, remind them to listen to the narrator's voice. Make sure they like the narration. One thing I do like about the apps, though, is they also have, some of them have like little yoga poses to do before bedtime or little yoga practices to do during the day. Those are always really helpful. And that's really all I have for now. So I just wanted to remind everybody, I'm representing AspenRidge Recovery, and our mission is to empower and support those struggling with addiction to discover their best selves and their best lives.